I gave a talk on recent therapeutic advances in follicular lymphoma, and we discussed some of the new strategies such as pathway inhibition, particularly through BCR signaling, so the use of the PI3 kinase inhibitors, and emerging data on some of those newer agents. We also discussed the role of ibrutinib and other BTK inhibitors in the management of follicular lymphoma. We discussed also agents that may target the microenvironment, so the immunomodulatory agents such as lenalidomide, and how the addition of rituximab has been tested with rituximab and lenalidomide in the frontline setting against our chemotherapy. Most of my talk, however, focused on data regarding the third generation anti-CD20 monoclonal antibody obinutuzimab, which has enhanced ADCC activity. And the GALLIUM study, which compared obinutuzimab with chemotherapy against rituximab and chemotherapy in the frontline setting for patients with follicular lymphoma with a clear indication for therapy. Now, this was the largest study ever undertaken in follicular lymphoma. 1,200 patients were recruited. The site could choose which chemotherapy they would like to use from a list of Bendamustine, CHOP, or CVP. And those patients had induction immunochemotherapy, and that was followed by maintenance according to the arm that they had been assigned, so either with obinutuzimab or rituximab, that went on for 2 years. Now, the primary endpoint of the study was investigator-assessed progression-free survival, and this came out clearly in favour of obinutuzimab with a hazard ratio on the curve of 0.66. So that equates to a 34% reduction in progression events and death events in favour of using obinutuzimab. Now, there's no overall survival advantage yet has been determined. Now, there was a difference in safety between the arms of the patients treated with obinutuzumab and those with rituximab. Those patients with obinutuzumab had a greater rate of neutropenia, of infections, and also infusion-related reactions. But these are all things that we have recognized already with the use of obinutuzumab. What was very interesting about this study was the number of the amount of toxicity in those patients receiving either rituximab or obinutuzumab in combination with bendamustine. And it was particularly important because we saw some significant events during the maintenance and later phase. And Wolfgang Hiedemann went on to show data here at the meeting regarding how significantly immunosuppressive that combination is, with really a marked reduction in peripheral blood T-cell counts, and that was sustained. So I think there's some really interesting data from the GALLIUM study has come out during the last few months, and particularly updated at this meeting. I also discussed during my talk the use of obinutuzumab in patients who have become resistant to rituximab, and the Magdalen study, where bendamustine on its own was compared with bendamustine and obinutuzumab. And again, this showed a progression-free survival advantage in favour of the combination, but also demonstrates a clear overall survival advantage. So there's been some really key therapeutic advances in the management of follicular lymphoma that have been reported over the last few months.